Okay. Well, to start with, I was terrified about having anything done because I didn't want to walk around with that stretched look that everyone seems to associate with facelifts. So coming here, it was very scary to begin with until I met Dr De Silva, which was lovely. I was still terrified because I thought my insecurities being I'd always sit like this or I'd sit like this and I'd hide my weak chin. I thought, you know, the wrinkles and the saggy skin as you get older. And I thought he might not agree that I've got this to begin with. So it was trying to convince him of what I actually felt, which, you know, he was very, very good. He listened, which was lovely. And then when I said, yes, I want to go ahead, because he talked about it being natural, about not having that stretched look. The first thing he talked about was how he works so it doesn't look as if you've had anything done, which was my biggest fear. I didn't want everyone to go, what she had done, because sometimes that's not a good thing for people to say. You think, why, what's wrong with it? Do I look that bad? But that's why I went ahead. I got here that morning, which was quite early in the morning, absolutely terrified of the whole thing, but more so I thought I was going to be awake because I was having the twilight sedative. I'd not had that before. Literally walked straight in, lovely atmosphere, everyone was friendly, it was really nice, and I thought, okay, right, now comes the scary bit. Walked into, I thought going to be a theatre, you know, like an operating theatre, but it wasn't. There was music playing, which was lovely. Everyone was chatting, literally got on the bed, talked to the anaesthetist, who'd already talked to me in the room anyway, and literally he put the jab in the back of my arm. I literally thought, oh, I've had a couple of gin and tonics, and that's the last thing I remember until 6 hours later, apparently. Wow, 6 hours, where did them 6 hours go? It was over. And I literally woke up and thought, okay, is it done? Walked back to the bedroom, and the nursing staff were lovely. Sat there, had a cup of coffee, went to the bathroom, and it was like I'd not had anything done until I actually looked in the mirror and I thought, oh, I have had it done. They weren't joking, I actually have had it done. So if you're scared about the sedative, if you're scared about the procedure, please don't be. You don't feel a thing, which is a shame because it probably would have been nice to have chatted about it, but I don't remember a thing about it. Absolutely no pain. And I went home the next morning with absolutely no pain. I mean, they literally had to force me to take some painkillers because I didn't feel anything. I kept waiting the whole week afterwards for this pain to get there, but nothing happened, no pain. The most uncomfortable thing, which the doctor had told me about, was my drains. And they're a drain, they really are a drain, but they're not painful, they're just, you get used to these things swinging around. And that was the most uncomfortable thing out of the whole procedure. But the rest, as they say, is history. Right, so now we're, I think, 8-9 weeks post-op, and the difference is I can go out now and not have to sit there and worry about how I look. You know I look okay, I know I look nice, so I'm not worried about, does my chin look, you know, does my neck look terrible. In actual fact, it's nice because I don't have to worry about it. You know, I feel more confident. I can wear my hair up now and not have to worry about it. I'm not sitting there constantly thinking in the mirror, is it okay, going to the bathroom, and I think all women know this, that you look in the mirror and you see the reflection back and it's not who you think it is, and your stomach sort of sinks and you think, oh God, I look terrible today. I haven't had that. And that's through all the bruising and everything. I haven't had that feeling of, oh my God. And in actual fact, it's lovely because every morning I get up and I see a different change. I see, look at my neck, you know, and even my daughter, my 40-year-old daughter, is envious of this neck. I mean, come on, you know, who wouldn't be envious of this neck? And even putting a necklace on now, it is, you know, I haven't got that woggly bit, as ladies know what I'm talking about. I haven't got that hangy bit of skin, you know, and it's lovely. It's like, wow. So the rest is just going to get better, and that's lovely. Every morning I wake up and I can see difference. I can see a change, and in me, I can see that change in me. I just feel more confident.
And Jacqueline, like knowing what you know now, is there any advice you give to like a family or friend who's thinking about doing this?
Hurry up, get it done. Don't waste your time. Don't waste your time worrying about it. Do it, because you'll regret the time you've waited to do it. I regret the last sort of 3 or 4 years thinking, oh no, what ifs? What if this? What if that? Do your research, of course, do your research. Always do your research. Feel comfortable with your surgeon. And that's the first thing. I felt so comfortable with you. You made me feel confident in you, which is so important, because this is your face. You've got to go through the rest of your life with your face. So do your research. You know what you want done. And be honest with the surgeon about what you want done. And if you aren't honest with the surgeon, he can't do his best work, because you're not telling him what it is you're worried about or upset about. But ultimately, you only get one life. Live it to your fullest. And if that means you want to do this, you do it. You don't need to make excuses for yourself. Why should you? Life's for living.